Hey everyone, my name is Katie Edwards. I'm the Senior Medical Provider here at Trident, and today's topic hits a little closer to home for me. Today we're going to discuss females' hormones specifically. So ladies, I know that each and every one of us at one point in time has either described ourselves or been described as being hormonal. Well, it's not really our fault. We have a lot of hormones going on, and we have a lot of changing hormones that occur throughout the course of our life. So my goal today is to try to shed some light on these hormones, what the imbalances can cause, and how we can correct them. So a common thought process, and not a wrong thought process, is that the older we get, the more our hormones change. And this is true, but I always like to ask these questions to kind of get a gauge for where we are relative to where we were. And that's an important question to ask ourselves when we contemplate the aging process. So if you think about things like, have you felt more tired than you think you should? For example, if you wake up at 6 o'clock in the morning, go to the gym, come home, fix breakfast, gets the kids ready for school, goes to work, come home, pick the kids up, cook dinner, homework, bed, you should feel a little tired at the end of the day. But if relative to what you're doing and have been doing, you feel more tired, that's an indication that there's been changes. Have you ever felt like last year I was able to do this without a problem? 2 years ago I could have done this without any issue. Have you noticed changes in your body despite any changes to your diet or your exercise? Have you felt like I look in the mirror and this just isn't me? This isn't what I'm supposed to be or what I feel like? Well, you can thank your hormones for that. This is my attempt at some science humor here. So ladies, you can see when we look at our basic overview, we're not so basic. Like I mentioned at the beginning, we have a lot of hormones, and we have a lot of hormones that change throughout the course of our life, from when we're born to when we go through puberty, to pregnancy, to premenopause, menopause, postmenopause. So rightfully so, we can say we have a lot going on. I keep mentioning that we have a lot of hormones, but what exactly do we have? So normally if I do this presentation live, I'll leave this slide blank and have people shout out answers. And typically I'll get estrogen, progesterone, sometimes I'll get testosterone, thyroid kind of comes up every now and then, but the rest are really hormones that a lot of people don't even know we have. So when we think about hormones, typically reproductive hormones are the ones that come to mind. But we also have stress hormones, we have growth hormone, the thyroid hormone. So hormone by definition just means something that is made by one gland to send a signal or cause a reaction in another. So hormones are what make our body go. So throughout these next few slides, my goal is to kind of give us a general background of each of these hormones that we mentioned on the previous slide, just to kind of better know what they do and what their function is. So we're going to start with our thyroid stimulating hormone. So this is a hormone panel that you've probably seen at your regular annual physical. We check this routinely because this is one of the most common hormones that starts to change with age. This is also a very common hormone that has hereditary links. So a lot of times if you have family members that have overactive or underactive thyroid, that's something that can be passed down. So in a nutshell, the thyroid is really the body's thermostat. So it has a hand in controlling a little bit of everything that our body does. So our body temperature, our energy, our metabolism, hair and skin texture, our sleep, and our moods. So depending on what the function of the thyroid is, those are either going to be elevated or depressed. So a hypothyroid is an underfunctioning thyroid. So that's going to cause a decrease in energy, dry skin and hair, a decrease in moods, trouble sleeping, and in terms of our cycles, heavy irregular periods. An overactive thyroid or hyperthyroid has some other side effects, namely headaches, we can sweat more, increased moods, increased anxiety, diarrhea, and lighter or missed periods. Most of us know we have estrogen. That's one of the most common ones that people guess. But did you know we actually have different types of estrogen? We can't just leave it at having multiple hormones. We have to have multiple types of multiple hormones. So our body creates these 3 different types during different times in our lives. So for instance, estradiol is our main estrogen. Estrone is one that's produced only during pregnancy. And estriol is one that kind of floats around and will spike if there's issues with the ovaries or the uterus. So every time we talk about estrogen, we're always going to note if it's estrogen dominant or estrogen deficient. And this is a relation to progesterone. So estrogen and progesterone cycle throughout the course of our month. So if the end of the month, if we get pregnant, both these hormones skyrocket. If not, they drop off, and that's what causes us to have our period. So we look at these levels in relation to one another to determine the side effects that they can produce. So most commonly when we think about estrogen, perimenopause, menopause, postmenopause, those symptoms kind of come to mind. And you'll see those on the right-hand column. So the hot flashes, the night sweats, the trouble sleeping, the mood swings, those are all very common side effects or symptoms of menopause. So if you notice, that's because our estrogen levels are starting to decrease relative to our progesterone levels. So having that lower level or that imbalance contributes to those symptoms. It can also cause palpitations where your heart beats irregularly, foggy thinking or decreased mental clarity, trouble with urinary incontinence, and decreased bone density. On the counter side, when our estrogen levels become dominant or become more elevated relative to the progesterone, this is where we can see changes such as breast tenderness, fibrocystic breast, meaning our breast tissue is more dense, fatigue, bloating and water retention, we start to crave sugar a lot more, headaches, weight gain. Those are symptoms that most of us would correlate with PMS. And that's exactly what happens. Again, those levels are cycling and roller coastering throughout the course of the month, contributing to those changes relative to the progesterone. So we keep mentioning progesterone. So what is it? Progesterone is another one of our reproductive hormones that literally means pro-gestation or pro-pregnancy. So this is the hormone that is going to skyrocket and really what keeps our uterus nice and happy and healthy for the baby growing in it. When we're not pregnant, it acts as a hormone balancer. So it's kind of the equalizer between our estrogen, testosterone, and DHEA, keeping everybody at bay and happy. This is the most deficient hormone in women ages 30 to 50. So after puberty, before menopause, this is a very common hormone to get wacky. So when this starts to change, and again relative to our estrogen levels, it can contribute to trouble staying asleep, which then causes you to have fatigue throughout the daytime, mood swings, low libido, and irregular periods. Testosterone is most oftenly corresponded to men, and it's not wrong. That's one of their most common and most prevalent reproductive hormones. But we make it too, and it actually has a big impact on our hormones and on our day-to-day functioning. The symptoms and the benefits of testosterone are very similar to those in men. It contributes to our libido, our muscle strength, our muscle production, energy levels, metabolism, and our moods. Interestingly enough, this is actually the only reproductive hormone that continues to be made after we hit menopause. So when all of our other hormone levels are decreasing, the testosterone level, although it decreases, still continues to be made at smaller amounts. So increasing this can actually have more benefits to our body and our hormones because our body still recognizes it as normal because it's already producing it. DHEA is kind of the stepchild of our reproductive hormones. Most people don't really know about it and they don't really know what it does, but it is an integral part of our hormone balance. So DHEA is what we know as a prohormone, meaning our body doesn't use it directly as is, but it actually breaks it down into about 50% estrogen and 50% testosterone. So it boosts our body's natural production by giving it the building blocks to do so. It's also the precursor to multiple other hormones and helps our body to efficiently use the hormones that we have. So now we're going to take a break from the reproductive hormones and talk about our stress hormones. So unfortunately, we all live in a world that has a fair amount of stress in it. Our body classifies stress in two categories, physical and emotional. So cortisol is our body's manifestation of our physical stress. This is truly our fight or flight hormone. So evolutionarily, our body is pre-programmed to either stay in fight or to get the heck out of the danger area. Cortisol is what tells our body to do that. It's produced by the adrenal glands, which sit on top of the kidneys, and that's really their only job in life, is to regulate how much cortisol our body is producing. So this is really a direct representation of how our body is responding to the physical stress. So if our cortisol levels are elevated, or those adrenal glands are pumping out too much, that can contribute to hypertension, high blood sugar, weight gain, water retention, and trouble sleeping. Whereas if our adrenal glands get tired or fatigued and produce too little cortisol, that can contribute to daytime sleepiness, weakness, depression, low blood sugar, and lightheadedness and dizziness. Homocysteine, on the other hand, is our body's emotional stress hormone. So this is the physical manifestation of the emotional stress we put our body through. So our job, our family, our friends, finances, travel, kids, you get the picture. Most of us have elevated homocysteine levels. And again, it's because we live in a world that has these daily stressors. The problem with homocysteine is even though it's a representation of the outside stress, elevated levels can contribute to causing plaque in the arteries that go to the heart, which means stress can kill you. And so that's one of the things that we really take seriously and want to monitor in order to decrease that level. The way we decrease it is with B complex vitamins. So the B vitamins will bind to the homocysteine. B vitamins are water soluble, which means whatever our body's not using, it just wants to get rid of. And water soluble trash goes out with our urine. So you literally just pee off your extra stress hormone. This is going to help to improve your mental clarity, your energy levels, and your metabolism. Growth hormone is probably one of my favorite hormones to explain to patients, mostly because this is the classic, quote, I used to be able to do this, end quote, hormone. Our growth hormone levels naturally spike between about 2 and 4 a.m. So in theory, when we are in a deep REM restorative sleep, our body's levels are spiking, which then helps to kind of reboot our body. That's what contributes to our cell repair, metabolism, that restorative sleep, and recovery. When we're kids and teenagers, our growth hormone spike is through the roof. That's why kids and teenagers can eat whatever they want. They sleep like angels. They're never sore. They recover very quickly, and they heal very quickly. Their body has a ton of building blocks in order to help them do that. After we hit puberty and our body stops physically growing, our body's growth hormone levels start to decline. So from the outside, it looks like we've stopped growing, which is true. But from the inside, our body also doesn't have as much of the resources to help us to repair and recover as it once did. From a physiologic standpoint, we compare ourselves through the different time periods in our life. So childhood and puberty versus adulthood. So when you look at these two different periods of times in our lives, our body physically has different goals and aspirations. When we're kids and teenagers, our body's main goal is to grow. We're growing up, we're growing organs, we're growing tendons, we're growing bones. So that is a big priority for the body. We're also very active, which means we need to recover from that activity. And then we have some fat storage. That's where our body stores our extra fuel. Now, again, when we transition to adulthood, the main piece of the pie that changes is the growth portion. But when you look at it, even if our activity level stays relatively the same, in order to make up that entire 100%, our fat storage changes significantly in that course of time. Why does that have to happen, you might ask? Well, and if you've heard my other presentations, bear with me, but this is a common theme that I think is important to mention. Our bodies evolutionarily are cavemen. So when you go back to cavemen time, men and women had different priorities in terms of being productive to the tribe. And this is where we will compare ourselves to men a little bit and differentiate between our hormones and theirs. So when men are young and in their prime, their main goal is to be strong, to be fast, and to be able to recover. Because they're going out, they're gathering the food, they're hunting the dinosaurs, they're making the fire, so their hormones correspond accordingly. As women, unfortunately, in caveman time, the only thing we were good at was making babies. Now I understand that nowadays we have a lot more contributions, but evolutionarily our body hasn't caught up yet. So we needed to be fertile, we needed to be able to recover from childbirth, and we needed energy to keep up with the cavemen and the cave babies. So that's where our hormones come into play. After we're not reproductive anymore, our body now is no longer good to the tribe. So we are not being productive, we are not contributing, we are merely surviving. So men and women hit this point at different parts in their lives. Men a little bit earlier, us a little bit later. But the main goal for survival is warmth, protection, and to be low maintenance. So what makes all that happen? Fat. Fat is warm, it protects our vital organs, and when our metabolism slows down and we're more tired more often, we're less of a burden to the tribe. Fat is important to mention here because the places that our body likes to allocate our fat is typically around our midsection, back, and thighs. The reason that is, that's where all of our important stuff lies. It's okay if a dinosaur eats our arm, we'll make it. But if a dinosaur eats our liver, we're not going to have such a good outcome. So our body is smart in that way, in that it protects our vital organs. So I mentioned that men and women's hormones change at different points in their lives. If you look at ours, like I mentioned throughout this entire presentation, our hormones change a whole lot. So we're born, we go through puberty, that's a roller coaster. They stabilize a little bit, then we get pregnant, then we get into the perimenopause and menopause part of our lives. So by definition, perimenopause means a change in the regularity, frequency, or heaviness of your periods. And menopause is a year or more without your period or cycle. So you'll note the average age of menopause in women in the United States is 52 years old. I would hope by now in the presentation you understand where I'm going with this. That to stabilize our hormones and to prevent the symptoms that low or imbalanced hormones contribute to, the answer is hormone replacement. Now, I also realize that there has been a lot of bad rap about hormone replacement in medical literature, in society, and I'm sure a lot of your doctors have mentioned in the past that hormones are dangerous. And they're right. In the past, there were studies done that showed that hormone replacement contributed to increased cancer risks, cardiovascular disease, and blood clots. However, in 2012, the Journal of Clinical Endocrinology and Metabolism released a rebuttal to that previous study that showed that men and women who were on bioidentical hormone replacement, meaning hormone replacement that was guided by their symptoms and their lab values, had no increased risk of breast cancer rates, had no rare events of cardiovascular disease or blood clots, and actually had a beneficial risk to benefit ratio. So that study in place, as long as you are undergoing medical treatment with bioidentical hormone replacement, you have the same lifetime risk of breast, ovarian, uterine, or cervical cancer as you do right now sitting here. As we've mentioned though, reproductive hormones are only a small part of the hormone changes that occur in our body. So there's other ways that we can get similar benefits without doing full-blown hormone replacement. And that's what we call nutraceuticals. So nutraceutical therapy, as opposed to pharmaceutical therapy, is the use of amino acids and peptides to give back the body what it lacks the older we get. When you break down our body, amino acids are literally the building block for every cell we make. So we get a certain percentage of amino acids from our food, and we get a certain number that our body makes intrinsically. When you combine amino acids, that forms a peptide. So peptides are key in rebuilding our body's ability to recover and repair. The body takes peptides and it breaks them down into the individual amino acids that makes them up. Anytime you give your body something that it has to work for to get a result from, you're going to get more benefit than just giving it the thing that makes it up. So in this case, as opposed to just taking amino acids, taking peptides will give you the benefit, but also gives you the added benefit of increases your body's growth hormone. That then contributes to the ability for your body to repair, recover, get better sleep, and to rebuild. Hopefully now I've intrigued you to get an idea of what your hormone levels look like. And that's step one. We check your labs. So here at Trident, we do a very extensive comprehensive lab panel. So it includes what you would get at an annual physical, plus the hormones that we've discussed, plus your vitamin levels, to get a really good overall idea of what your body's doing internally. Then you schedule a consult. You come in, you speak to one of our providers. They create a customized therapy plan for you based off of your needs, your goals, and your symptoms. So we look forward to hearing from you soon. If you have any questions, please give us a call at the office, 954-451-5454, or visit our website at www.tridentantiaging.com. Thanks, everyone.